Menstrual hygiene. Tips to help maintain a good hygiene during your periods. Menstruation is also known by the terms menses, menstrual period, menstrual cycle, or monthly period. Menstruation is a time when women are at a high risk of infection, skin irritations, urinary tract infections, and other health issues. Maintaining proper menstrual hygiene during menstruation is an absolute necessity. Before I elaborate on hygiene, let me stress upon the fact that there is nothing unhygienic about menstruation. The only thing that needs to be taken care of is that you stay clean. Your menstrual blood is a rich source of nutrition for the bacteria, and the chances of infection increase if hygiene is not maintained. Hence, taking the special care of intimate parts is needed during menstrual flow to ensure personal hygiene. Poor menstrual hygiene is caused by lack of education on the issue, persisting taboos and stigma, limited access to hygienic menstrual products, and poor sanitation infrastructure. May 28 is globally celebrated as Menstrual Hygiene Day to break taboos surrounding menstruation and raise awareness of the importance of good menstrual hygiene management. The organizers chose this date because the average duration of a cycle is 28 days, and on average, women and girls menstruate for 5 days per month. To stay away from all the uneasiness, you need to follow a few basic hygiene tips. Wash your hands before and after changing a tampon or pad. It's important to wash your hands before changing any sanitary product, especially if it's a tampon or menstrual cup which you insert into your vagina. Cut short your nails. Using clean hands will reduce the risk of introducing germs to your vagina or genital area which could cause infections. Washing your hands after changing a sanitary product is also important to avoid transferring bacteria from your genitals or bottom to anything you touch afterwards. Change sanitary napkin and tampons regularly. Do not wear your sanitary pads for long. Always wash your hands and change your period product every 2 to 4 or 4 to 6 hours depending on the type of product and how heavy your flow is. When you are active during the day, menstrual flow is normally heavier, so the pads absorbs more blood, sweat and sebum, which is why you shouldn't wear one pad for more than 4 hours. When you are asleep, your bodily functions slow down and the bleeding intensity decreases, so you can safely wear a pad overnight. Ideally, changing your pad every 4 to 6 hours is good. If not every day, do this on the first 2 days when the flow is heavier. On others too, don't wear the same pad for more than 8 hours. Regularly changing your product of choice will prevent bacteria growing on the blood, which can create a bad odor and leave you more prone to infection. Never use tampons for more than 8 hours. They are associated with the risk of toxic shock syndrome, a severe infection. Wear comfortable, clean, and properly dried undergarments. Always wear comfortable, loose clothing rather than jeans or tight fitting during periods. Soft cotton underwear and loose fitting clothes will help you stay fresh and dry, keeping moisture at bay. Wearing tight thongs or underwear doesn't allow your skin to breathe, will lead to higher risk of infections. It's advisable to keep separate underwear to be used during the period. If stained, wash it immediately and disinfect it. Wash the underwear separately with hypoallergenic detergents. Keep an extra pair handy when you are going out just in case you need it. Have a bath regularly. Yes, people who are menstruating can safely take baths. In some cultures, it's believed that women should not wash their bodies or shower during menstruation. Bathing not only cleanses your body but also gives you a chance to clean your private parts well as relieve your mood. Taking regular baths at least twice a day is required when you are observing your period. Normally, running water is perfectly fine. It's okay to use normal soaps with cold to lukewarm water. Avoid using very hot water as it may provoke heavier bleeding. Make sure you wash your vulva correctly. Use the right washing technique. Wash the genitals from front to back. Start by washing your labia and then proceed to the perineum and anus from the vagina to the anal area. Never wash in the opposite direction. Washing in the opposite direction can cause bacteria from the anus to lodge in the vagina and urethral opening, leading to infections. Dry the area with a clean cloth every time after washing. Wash your vulva every time you use the toilet. The outer part of the vagina has folds which can cause blood accumulation that may lead to bad odor. Healthcare providers recommend rinsing the genital area at least twice a day, morning and evening, while on your period. It's also acceptable to do this more often if you feel uncomfortable. Avoid soaps or other heavily perfumed vaginal hygiene products. Women are slightly more prone to bacterial infection when they are on their period due to changing pH levels and reduced immune level. Avoid using bath salts, vaginal sprays, or deodorants for intimate hygiene. Using this can kill the good bacteria, making way for infections and disrupt the natural flora in the vagina. When the vaginal flora becomes imbalanced, the risk of developing an infection is increased. The infections can lead to unpleasant symptoms such as itching, irritation, burning, abnormal discharge, and unpleasant vaginal odor. It's best to use warm water, but if you feel like you need to use a soap, make sure it has a mild natural formula that's gentle on intimate skin. You can use soap on the external parts but do not use it inside your vagina or vulva because the vagina has its own cleaning mechanism that works in a very fine balance of good and bad bacteria. Is it necessary to trim or shave pubic hair? Pubic hair is normal and the amount of hair in the pubic region varies from person to person. Sometimes people may notice an extreme variation in hair growth due to hormonal changes. Like other areas of the body, pubic hair does require regular cleaning. Does practicing pubic hair removal mean that you have better period hygiene? Not exactly. You really don't need to remove your pubic hair for any health reasons, sexual or otherwise, other than perhaps decreasing odor from sweat. Trimming or shaving your pubic hair is a personal preference. Pubic hair may help protect your genitalia from infection and friction. No matter which pubic hairstyle you go for, make sure to regularly wash your vulva, especially during your period. This helps decrease the chance of infection and odors. Use good sanitary products and use one method of sanitation. Today there are a number of ways, including the use of sanitary napkins, tampons, and menstrual cups to stay clean. What period product should you use? The choice is up to you. Choose a product that you find comfortable and that is right for your flow. In India, most unmarried girls prefer to use sanitary napkins. Women with sensitive skin may avoid sanitary pads as they can cause rashes, itchiness, and boils when rubbing against the skin. Some people pair up sanitary pads with cloth, tampons, or another pad during periods. It's not a good idea. Changing regularly is a better option. Multiple pads, cloth, tampons can lead to rashes and infections. Always choose sanitary products with an absorbency level that's appropriate for your menstrual flow. Extra absorbent sanitary products can be helpful if you have heavy periods, but you should always use a product that has the lowest absorbency you need for your flow. This will help to avoid the risk of bacterial growth, which can lead to infections. Extra absorbent tampons may increase the risk of toxic shock syndrome and soak up more of your natural vaginal fluids, which isn't great for the health of your vagina. Discard used sanitary pads properly. Discarding your used pads or tampons properly is important because they are capable of spreading infections and causing a bad smell. It's advised not to flush the pad or tampon down the toilet since they can clog plumbing, thereby causing the toilet to back up. After use, wrap sanitary napkins properly and throw them in a bin. It's not compulsory to wash pads, but majority of women wash their sanitary pads before disposal because disposed pads will be mixed with general waste and managed like general waste. Pads can harbor serious infectious agents and need to be disposed of properly. Hence, washing pads minimize any smell and prevent the spread of bacteria which can build up over time. Beware of a pad rash. Wearing sanitary pads for too long can make the vagina damp, and continuous rubbing of a pad against your skin can lead to rashes, inflammation, and itchiness on your skin. To prevent this from occurring, try to stay dry during your periods. Apply an antiseptic ointment after a bath or before bed. This will heal the rash and prevent further chafing. Always have stuff handy. Because periods may come unexpectedly, it's always good to be prepared so as to avoid embarrassment in public. It's important to have extra sanitary pads or tampons properly stored in a clean pouch or paper bag. Storing them properly is more important so that they don't get contaminated. Try wipes for on the go freshness. Menstruating can make you feel like you need to have a quick clean down there more regularly, especially if your flow is heavy. Pad wearers are more prone to menstrual blood drying around the vulva. To help freshen up on the go, you can use intimate wet wipes, which will leave you feeling cleaner between period product changes. Choose products that are free from alcohol and fragrance and have a balanced pH level to minimize the chance of irritation. Maintain good hygiene at night. Just make sure you change your pad, tampon, or cup right before you go to bed and as soon as you wake up. If your flow is heavy, use a overnight pad. Pads with wings also tend to stay in place better during all your tossing and turning through the night and protect the sides of your underwear. If period blood gets on your bed linen or clothes, wash a stain with cold water using regular soap. Hot water doesn't work well for blood stains. The best position to prevent period leaks is sleeping on your side in the fetal position. This position eases the pressure on your abdominal muscles and prevent period leakages too. Stay active. On your periods, you may experience stomach cramps, have backache, leg cramps, and stiffness, but staying active is very important for your well being. It's okay to rest for a while. It's beneficial to take breaks and go for a walk to let your period blood flow unobstructed. So, try gentle stretches or brisk walking to loosen your muscles and get your blood pumping. Consuming a balanced diet and drinking plenty of water to maintain hydration, especially during your periods, is of utmost importance. Unhealthy eating habits lead to hormonal imbalance, which in turn is linked to irregular periods. Increase the intake of whole grains, fruits, and leafy vegetables. At the same time, reduce the consumption of salt, spicy foods, and caffeine. This will prevent bloating and help you feel at ease. Menstrual hygiene is an intrinsic part of our monthly cycle. There are quality feminine hygiene products in the market that can be used for the purpose. In case there is any strong abnormal smell or change in flow or color of discharge or menstrual flow, make sure to contact a specialist immediately. Thank you.